being projected, and I think most of you have copies. Basically, we have, we'll go over a very brief introduction on BDN and sort of the 2026 research implementation plan for Vietnam. Then we'll have a bit of an update from the strategic partners related to food system transformation in Vietnam. So that can just be going around the table. Then I'll discuss very briefly the CAPSHA project, and then we can finalize with an open discussion, basically to see what are our next plans, what kind of evidence do you need to support food system transformation in Vietnam, and begin to think again, where is the process here in Vietnam going, so we can prepare eventually for 2027 later this year. So that's more or less the agenda. Do we need to do introductions, or does everybody know each other?
Maybe because Rasmi cannot turn on the video, but also with the
Okay.
online.
Yeah, so Rasmi, I don't know, are you able to get your video working or no?
Okay.
There we go. Rasmi, would you like to introduce yourself?
Yeah, sure. Hi, good afternoon. Thank you everyone for bringing me onto this meeting. I'm Rasmi. I'm a research fellow with IFPRI, and I have recently started to work on this project, the capacity sharing project, which is part of BDN. I have been communicating with some of you over emails related to the contracts for the part of the work related to capacity sharing, and I'm really glad to be here and looking forward to learning from all of you. Thanks.
Welcome, Rasmi. Do we need to do an intro of everyone here or not, Tian? No. Rasmi, I'll ask everyone when they speak to introduce themselves so they know you know who is talking.
Yes.
That might help.
That could be super helpful.
The room will be a bit challenging.
Yeah.
We have quite a few people here. Okay, great. Great. So let's and Deborah, I think we know. Do you want to say hello? I think everyone knows you, but I don't know if you want to say hello.
Sure, I can say hello. Hello, everyone. Good afternoon. Nice to see you all. I'm happy to be part of today's BDN and CCU meeting. Looking forward to the discussion. Thank you.
Thanks, Deborah. Okay, with that, we have a few slides to go through. Are there any comments or questions on the agenda? No,
it's okay.
It's okay. You sure?
Yeah.
Okay, good. Okay, then let's start then maybe with the quick introduction to better diets and nutrition and the work we'll be doing here. That's the wrong one. That's the CAPSHA one. Yeah, better diets and nutrition and the work that will be done in Vietnam in 2026. Okay, we will open it in 1 minute. So just to start, as many of you know, many of you have been involved for quite some time with the engagement with CGIAR here in Vietnam. So we've transitioned from, this is now our third program. We started with agriculture, food, nutrition, and health, which then became SHIFT. And now we're talking about better diets for nutrition, or BDN. So I want to start by thanking all of you, because we've established since I think 2018, 2017,
Yeah,
maybe?
2018 officially, but like 2017.
Right. So 2017, 2018, we started establishing the network with all of you. And since then, I think we've managed to do quite a bit together, and it's been, I think, very useful and interesting to collaborate. And again, none of this would be possible without all of the great work from partners here in Vietnam, with working together with us on this. So we thank you very much for that. So let me go ahead and give the quick overview of the slides today. I'm going to provide an overview, a very high-level overview of the program of Better Diets and Nutrition, so everybody is on the same page. What are we talking about? And then,
Finally.
Okay.
No, the most important factor.
Now we can start. Dr.
Nutrition.
Maya.
Yellow and yellow.
It's okay. It's okay.
Sắp thành đại biểu Quốc hội rồi. Sắp thành đại biểu rồi.
Bài đã vào Quốc hội chưa?
Vừa mới vào xong lại chạy ra rồi.
Vào nhờ nó hết ghế.
Con chạy ra nhiều người khác để mình về làm food system anh ạ.
So for everyone online, we just have Dr. Mai joining us from the National Institute of Nutrition, so Vice Director Mai. Okay, so the agenda is to provide sort of an overview of better diets and nutrition. And basically the work that will be done in Vietnam. Then we'll be talking about the theory of change, how the program thinks it will achieve the changes. And that is for discussion. Obviously, we'll outline it and perhaps provide we'll share our outcomes and our assumptions, and we can see if it makes sense. Then we'll discuss the planned activities specifically in Vietnam for 2026. Share a few quick, and we can reflect a little bit on that. Then I want to share with you some information on the Netherlands Senior Experts Program, because we have people assigned to work with us in BDN from that program. And I want to share with you who they are, and then we can discuss next steps there. And that's what we have basically for this first section on the updates on the presentation. Okay. And again, we can share the slides and we can share everything with all this information with you after this. So this is sort of a snapshot of what Better Diets and Nutrition is trying to do. So the target here again is not new to any of you. You've seen this many times in different language. It continues to be the same overall objective. And here we're talking about basically consumers shifting towards healthy diets, sustainable healthy diets. That's the target, right? So here we want diets that are accessible, affordable, available, safe, and desirable, and that consumers can make the choice to consume those diets, right? So that's the overall objective. The project or the program responds to specific needs, particularly at the level of food systems. So the first one is obviously that poor diets are a major cause of malnutrition. Oftentimes, and food systems do not deliver these diets, healthy diets on a consistent basis, right? So this is the challenge we face. So how do we ensure this? And basically we focus on co-design of research-based solutions, because this is a research program. So it's the idea of how do we develop evidence and knowledge that can help support processes of transformation in countries. Go back, please. Your mouse is going crazy. Okay, that's good. Stay there. Stop mouse, don't move. Okay. And so basically we're talking about how can we use the evidence we generate to influence policies and help shape policies. And I think we've already done this in Vietnam for quite some time, so I think that's not new. How do we build solutions here we talk about some of the work on an end-to-end approach, which is a piece of BDN. And then also how can we support leadership for impact and change, right? So again, I think at the end of the day, we're talking about a program that seeks to support all of you who are leading the process of change in Vietnam with the generation of evidence and the co-development of approaches, methods, tools that help you drive change. But at the end of the day, it's really about supporting the process in Vietnam. Yeah, no one has the recipe for how to achieve perfect food system transformation. We hope that our evidence can help Vietnam develop a recipe that makes sense for the needs of the country. And here we have some of the targets about impact. So we would like, one of our key indicators is minimum dietary diversity for women. So again, Dr. Mai knows this indicator very well. And then also an increase in the percentage of the population who can afford a healthy diet. So those are our two major indicators. And we obviously, these are all the countries we're working in, so the total population there would be very large. Vietnam is what, 103 million, 104, more or less? Or am I being, maybe I'm not, I don't know. More than 100.
Yeah.
So you've got a whole range, and this obviously is not the full population in each country, but it gives you an idea of the scope of what we're trying to achieve and how we will measure our changes. Next. Thank you. Now the mouse went to sleep. Okay, so so these are the target countries. Again, we have what are called tier 1 countries where we will implement most of our work. Vietnam is a tier 1 country. But then we also have some tier 2 countries, which are the ones in orange, yellow, where we will do some work. And then we have some specific countries where we think there will be spillover effects. So the case of Central America, so we work in Honduras and next door in Guatemala, we may have spillover effects. Yeah. And so that's a little bit the scope of where we're working, but our focus will be principally in the tier 1 countries. So again, Ethiopia, Tanzania, Bangladesh, Philippines, Vietnam, and then Honduras. So that's where we'll focus most of our effort going forward. These are the different areas of work, and I think you may have already seen this slide from Inga at some point. The history of this slide is that area of work 1, as described here, is very similar to the SHIFT project or program that we had previously in Vietnam. Area of work 2 focuses much more on market systems, and that's built on what was the Regoverning Markets science program. Area of work 3 is built on what was the FRESH initiative, and so that's focused initially on fruit and veg, but now is expanded, and that goes all the way from production to consumption. Area of work 4 focuses on biofortification, so that's building on the work in the past for biofortified crops. And then area of work 5 seeks to understand the linkages to social safety nets and other kind of school meals and other kinds of larger programs and how they intersect with diets and nutrition. And then area of work 6 is more about sharing the results from the first 5 areas of work regionally and globally. So it's more like how do we plug the lessons learned into specific regional spaces, like here in Asia would be ASEAN or whatever, any other spaces we think are relevant. In Africa, it's with the African, with basically the African Union, et cetera. So that's trying to connect that and other global spaces. And the innovations we seek to develop are listed there. And the long-term outcomes, I think we've already discussed. Next. So again, we've discussed this. Basically in the case of Vietnam, the areas of work that are active here it's principally area of work 1 with a very small piece in area of work 2. So the other areas of work in the future, if there's demand, we can have conversations, but currently they do not have budget for activities in Vietnam this year. Okay, next. Okay, so now I'm going to go into what I apologize ahead of time for some what I find to be not very clear graphics, but I will try to walk you through them. And basically, this lays out sort of how we think change will happen as a program and how we think we can support it. And so basically, we're talking about how research can move into capacity, and then how capacity can move towards engagement, and how engagement can lead to changes in behavior, and how that can then contribute to outcomes. So basically, this is the area of work 1, which is the most relevant for us. Again, we'll share the slides so you can read all the very small print. I apologize. It's like I did not get I could not edit a slide, so I apologize for this. Basically, we have the green boxes in the top, so that are labeled 1.1, 1.2, and 1.3. Are basically what we consider our high-level outcomes or outputs, excuse me, that will be developed through the project. Those high-level outputs will then contribute to initial outcomes, which are the yellow boxes, and eventually to the final impact or outcome of the overall project, which is the pink box. And we can go through this. I think what's relevant here is 1.1 focuses basically on solutions at the consumer level. 1.2 focuses more on solutions at the vendor or MSME level. The first one is demand, the second is supply of healthy foods, and then the third is more the policy space. So here in Vietnam, I would say we have most of the work that we have for this year are mostly in 1.2 and 1.3. There is some continuing work in 1.1, Dr. Mai, with the existing data that's been gathered, but I would say that's where we are. And you can see the kind of change we hope to see occurring. So we hope to see principally the focus of this is on public sector actors, government actors, and how government actors through policy can drive change. We had a long discussion about should we work directly with consumers, should we work directly with vendors, but we felt that it was with the level of resources we have, it's very difficult to do that at scale. And so we felt the best way to approach this was through the policy pathway. Again, comments and criticisms and suggestions on this most welcome, but that was the discussion we've had. So that's the first slide on this. Next. And this is how area of work 2 then comes in as well. But this is basically, so we have area of work 1 and area of work 2 working. What area of work 2 will be working on? I mean, we can, we can discuss a little bit what the MSME work is if there's interest. But again, the idea there is to support micro, small, and medium enterprises so they can offer healthier food choices. And then in combination with what I've already discussed in area of work 1. We do have area of work 4 and area of work 6 because they could potentially work here, but this year there's no budget. So they're there because they're in the theory of change, but I don't think this year they will do anything because they do not have funded activities here in Vietnam. And I should also mention that the budget for this year is about 58% of last year, so it's much lower. So we're a little bit constrained. So what we're presenting is what we can do because there's no additional funding. We have a tight budget this year. Okay. So behind the theory of change, we have some assumptions. So the bold letters up here are the outcomes, and underneath are the assumptions. I don't know. I don't want to read through all of these, but I wanted to share them because if you want to review the slide deck and make any comments, particularly as they need to be adapted to the conditions in Vietnam, it would be very helpful. So this is a global perspective, and so therefore may not capture adequately how things work in Vietnam. So we would very much welcome any feedback or thoughts you have particularly about the assumptions. Yeah, are these assumptions correct? Do they make sense in Vietnam, or do they need to be changed? So that's something that we can, again, we will share the slides, and we would very much welcome any feedback. Eventually, we would like to have a specific version of the theory of change for Vietnam that very much that we're all aligned around, and we all think is realistic. So this is a global one. It needs to be tailored. Next. So that's sort of the overall framework. So what I'm going to discuss now is sort of the planned activities for 2026. And again, activities here combine research, capacity sharing, and engagement to influence decisions and practices. Again, none of this is surprising. We've done this before. You all know how these programs work. So I will share the research that we were able to get funding for this year in the next few slides. Next. Okay, there we go. Sorry. So we have basically, and I'll explain what the red boxes here are in a second. So basically, we have these aligned to the high level outcomes, and these are basically where we see the projects fitting. So around the goal of policymakers enacting policies and regulations through the FST-NAP and other policy processes, we think that the activities we have planned this year, which include the CCU and the work plan and everything the CCU will do, the dissemination of products and events describing key policy relevant messages. This is led by IFPRI. This is building on the data they've collected and they are still analyzing. They will generate additional publications this year. I don't have the details of what those are, but maybe Razmi can provide some input. And then we have two other pieces, which are engagements of reports on science policy interface and a summary report on the implementation of the policy process development, documenting framework. Thank you, Grace. At the provincial level in Vietnam, and those that are in the red box are part of the CAPSHA project. So CAPSHA is included here. But this is just broken out into, and we'll talk about CAPSHA in more detail, but those are included in CAPSHA. Likewise, under the second high-level outcome, where we have the decision makers align priorities across the public sector and private sectors to support food system transformation. Again, the major activities there will be around CAPSHA. So this is where we have the training of trainers program, and also the final technical packages for the subnational engagement. So we did a lot of work last year. You all worked very hard. Some of you worked very hard. And basically, we developed a series of methods and tools for the subnational work, correct? But we're still missing one or two steps. Yeah, Tu Yen says she doesn't want another slide yet. She says we should just finish this one first. But basically we're at the provincial level, we still need to work on the investment plan and on the PPDF and the tracking process, correct? And so those are two things that are pending this year. But the idea is that we have the final package of all the tools ready this year, and then we can share that with the Food System Transformation Partnership. And hopefully that can be used for in additional provinces. And again, we can discuss how that might look. Yeah, I mean, so we can see what that looks like. Okay, and on the previous slide, all of those were CAPSHA. Then we have two of the other high level outcomes here. One is that government actors implement MSME and informal actor-oriented solutions. And here we have two pieces of work. One is on the identification of MSMEs and networks and co-created solutions. So again, the forms is your work, and then progress implementation on those solutions. So those are the two deliverables we have. Then on the consumer-oriented solutions, we have two pieces. One are the papers that I described from IFPRI that again, maybe Razmi can provide some more input or insight into what analysis will be done this year. And then we also have the co-creation process that Deborah and Breeze that we're involved in with NIN and others, focusing particularly on adolescent school food environment. And basically here we're talking about a sort of a continued work on that to develop solutions about how we can work on adolescent school food environments. Next. And so this is sort of how things fit together. We have, again, the CAPSHA work is in blue, and I'll go into CAPSHA in more detail in another presentation. But I wanted to show you that all of these things fit together into one package of work. So CAPSHA is one part of BDN. It's not separate. And basically it all fits together. And then we also have these Dutch senior experts that I'll discuss in a second that could potentially be brought in and work with us on specific topics. So that's more or less how it all fits together in Vietnam for 2026. And again, you'll recognize that there is probably less work than before because of budgetary constraints, unfortunately. Okay, so I don't know, should we stop there before I go to this? I don't know if there are any questions to that point, because then we can go into explaining the experts, or do you want me to go through this and then we stop? So go through this first? Okay.
Yeah. Can just ask something
Do you have any
before
questions?
we go to.
Any questions on this? And Razmi, I don't know if you want to compliment, if you happen to know what the projected analysis or publications are from IFPRI for this year in Vietnam, it would be great. I don't know all the details.
Thanks, Max. No, I am not aware. Yeah, I am not aware, sorry, but I can definitely find out and come back to you on that.
Yeah, that would be great. I'm pretty sure Jeff will know, but
Jeff will know. Yeah, I'm not. Yeah.
Yeah. So he's not on the call right now, but maybe we can ask him when he joins.
Just one minor thing, that's the BDN not presented for the work of 2026. However, for the CAPSHA, we can go up to the 2027.
Yes.
Not to what you overlooked in that you don't need to finish the CAPSHA.
No. CAPSHA, yeah, we'll talk about that. But CAPSHA runs through July, or July, I think it's July 2027, correct? I don't know what the final date is in the contract. What's the final date? July?
September.
September. Okay, so it runs through September. I think September 2027. And likewise, I should mention that the Dutch experts are available for this year and next year. So we can also think about working with them on things that will take more than 1 year. Okay, so that's also important.
That's meeting.
Why not?
The expert from that has been support for.
Well, so we'll talk about that, and that's the next slide.
Okay, maybe we go next slide and then.
Yeah, so we'll see what the proposals are, and then and how we can work on that. Okay, so we can come back and have further questions at the end. So I also wanted to share with you this. So there is a senior experts program supported by the Dutch government, and not surprisingly, Dutch researchers. But basically, the objective here is to provide support so that Dutch researchers from universities across the Netherlands, and in this case, they all happen to be from Wageningen. That's a surprise, yeah. Anyway, are available to work on different topics across different parts of the CGIAR. So in the case of BDN, we were able to get several experts assigned, or they applied to work with us, I should say. The goal is to sort of bring Dutch scientific knowledge and expertise into the connections and work we have ongoing in each country. And then also, and so that's two ways, right? One is the Dutch coming to work in the countries, and then obviously also learning and taking knowledge back to share with the Netherlands or to share through universities. So it's a two-way. And the idea is that we should also use this as an opportunity to build research outcomes and capacities. So they should be working with all the partners in the country to help build capacity and support. And basically so we have now, we're in the 2024 to 2030 timeframe, and we have we'll go into, we have the experts that are working with BDN. But that's more or less what we're talking about. The experts have their time, part of their time is covered, and they have some operational budgets. So we can actually propose very specific pieces of work with them that would complement what we're doing in BDN. Okay, because we recognize that there are gaps in BDN. And when we look at the theory of change, clearly we have more work on some pieces than on others. And so the idea is to work with the experts to see if they can collaborate and help with all of us fill some of those gaps. Okay, next slide. These are the experts that eventually, there we go. These are the experts and some of the topics that are discussed. So we have Ezra Burkhout, who is working very much, he's an agricultural economist, working very much on micro and small and medium enterprises. And we have Dr. Michael van Dijk, and so he works very much on foresight analysis. His approach to foresight analysis is more about, I would say, scenario building. So foresight analysis based on scenario building and with more participatory approaches. So again, potentially quite relevant when we talk about at the national and subnational. Yeah. Then we have Sigrid Wortham Heck, who was here and been on for many years. Yeah, many years.
I know.
Yeah, we Fresh Studio, so we know Sigrid. Yeah. And she works very much on the sociology of consumers. And so this, for example, she has been interested in the work around adolescents and the school feeding, school food environment. So, for example, but we can do other things. And then finally, we have Bart Steenhuisen Peters, and he works on the political economy. Most of his work to date has been not in Vietnam. It's been mostly in the fresh countries, so mostly in Tanzania and Sri Lanka. So he's probably the furthest away from what we're doing, but nonetheless, he's also on the list. So here's a quick summary, and we have more information for each of them that we can share with you. What we suggest is this, that the country convener, so Jen,
Not coordinator.
convener, no? What are you, coordinator?
Yeah.
Okay, sorry, I change your name all the time. Okay, country coordinator. CC is easier, but the country coordinator, it will basically is how we can set up discussions with all of you to share in detail what each of the experts is working on or interested in.
Menu.
Right, at the menu, basically. And then based on that, we would then suggest we organize calls with the experts to discuss what can actually be done. What's feasible, what are they interested in doing, what would meet the needs of the strategic partners and sort of the theory of change in the country, what do we think needs to happen? And then basically what can be done this year. So very much, concrete planning, what can we do together? Yeah, because I think it's better to work with them and discuss with them rather than try to decide now what can be done. And then basically once we have that, then we would implement the agreed work plans for 2026. And again, there is the potential to propose activities that are for 2026 and 2027. So it's okay so we can be a little bit more creative. And Tuyen can share the details of what each expert is interested in doing, and then we can decide who wants to be in the conversation with the expert. Yeah. What?
I think we have 3 partners, 2 big partners.
Well, yeah. But there's some, for example, the expertise in nutrition is not here. So maybe Dr. Ma, we just need to have a good conversation with you to see if any of the things that are proposed. good link or support to what NIN is doing and how we can collaborate there.
Yeah, yeah.
Yeah.
The national team
Yeah.
cooperation with the government and NIN to continue using in the national nutrition survey that to continue with analysis. Yeah, I think it's the last time we have to have some report talk about. Yeah, I think good now we continue.
Okay. Yeah. So basically the way I look at it is these experts are available.
Yeah.
So let's take advantage of them being available. And let's have a good strategic conversation about where they can add the most value.
Yeah.
Yeah. So they have part of their time to work with us. And they have operational budgets, so they can come to Vietnam, they can do workshops, they can work with, so they can actually do concrete pieces of work. So let's take advantage of this. Yeah, as much as we can, in the way that makes the most sense. Yeah, go ahead.
Yeah, I think that's good. I try to set up follow-up meeting to make sure we can have enough time for you to discuss and also talk directly with them so we can further support along the process.
Okay. And I think that's probably the end of it. Yeah. So that's what I had to share.
But
So
we
maybe
still have another slot of CAPSHA.
Yeah.
It's just BDN.
Yeah. Well, CAPSHA is part of BDN, but this is all of BDN.
Yeah.
Yeah. So those were the slides. So I don't know if, and again, I don't know if anyone else wants to add anything. So I don't know if any of my colleagues want to add anything or if we can take questions. Any questions?
Yes, from my side, I think it's very interesting because we have a very good expert from Netherlands to support for us.
Yeah.
But I think from our team, from the past, I think we have very good one.
Yeah.
We want to support for first, but we have to know what we want to want to get the support from them.
Yeah.
And that's why I think from the past, I think our team will take a look for all the data we have.
Okay.
And what about the output from VAST and what if we want to make our research result very big impact, how to do, and we will learn something from them.
Okay.
And because you said, okay, yes, okay, because it's free.
Yeah.
We have very good team to support us. Okay, sure.
Yeah.
But we didn't know exactly who will be involved to us because we didn't know about the gap from our work now.
Yeah.
And that's why we need to review everything that we have to do here.
Yeah.
And it depends on the data we have. It depends on the output from the project. We have to give the impact to the policy maker, for example. That's why we will talk to them later.
Yeah. No, that's fine. I think that's a good idea.
So we will have the 2-round meeting. First, the meeting between maybe later because today we will not have enough time to talk very detailed. But I will have another separate meeting with the partners first, and then after that we will select the most likely topic you want to go forward, and then I will also have another meeting between the partners and the experts. Because that will be two-way exchange. We need more time to answer each other.
And we want to make it as concrete as possible.
Yes. And back to one question. We can contact with them anytime. And yes, it's okay.
I understand. So we would like to ensure that there's some level of coordination. So if you can keep Tuyen informed, that's fine. But I don't think there's any limitation.
So before we ask them something for the help, we have to send. For example, we have to send them some like some in detail what we want to do and what about the data we have, what we expect from that data.
Exactly.
And that's why we send to Tuyen first.
Well, just you can copy Tuyen. You don't. I mean, but I think what we would suggest is the first meeting. Yeah, the first meeting I think would be to explore exactly what each of the strategic senior experts is offering because there's more detail. And then we can discuss exactly as you say, what would be a potential demand from Vietnam. And then basically we would then have a meeting with the senior expert to see, is that possible? You know, what data do you have? So what I would like to get eventually is a work plan, right? That we can agree on with the senior expert and with the partners to implement.
But they just advise us anything inside the BDN program or outside?
Okay, well, inside, if we can. Because they're assigned, because they're
A
assigned.
little bit
I
outside.
know that. I know that and the BDN very
Big.
very big thing, but sometimes it's not big.
Not big enough, not big
Oh,
enough.
especially the respondent.
No, so I would suggest, I mean, so they are assigned officially to work with Better Diets and Nutrition, the program. Again, in conversations with them, let's see what's possible. I would suggest, because what we would like to see ideally is that the work plan with the senior expert aligns to the theory of change of BDN. Okay, but you know, we can discuss. So let's have that discussion to see how it works. Okay.
Yes, and that's maybe now we can contact with them directly. Or
Yeah.
not.
Well, let's first have the conversation. Let's first look at let's do the steps that we have on slide 18. So let's first have a review of what they're offering. And so Tien can meet with all of you, each partner individually, and she can then say, okay, this is what they're offering. What do you think you would like to do with them? And then we will convene a meeting with the expert where we can present the ideas, and then we can discuss. So the idea would be to have a 2-step, and the result of that would be a concrete work plan. Okay, and then the conversation is over to you and the expert to, we just want to make sure that the results, support the work we're doing here on food system transformation.
So in the expert team in Netherlands, they have only 4 people there.
Right now, yeah, but they have budget, and they can also identify and work with students. So these are the senior people, but then they can also bring in additional students or So then they have budget to work with other people. Okay, I don't know all the details, so we'll be able to discuss. Okay, but I think it's a good opportunity to expand.
Yes.
Yeah.
So maybe I have some comment. I think that yes, firstly, your activities design is clear. Yes, return into this table. I think that the outcome here we can produce. I think that this year in Vietnam we are realizing food system transformation with a very specific context. A lot of change. Firstly, the change at ministerial level. So I think that a lot of people changing the position, etc. So we need to make an effort to work also with the new people at the ministerial level. Firstly, to understand, re-understanding. This is the challenge.
Yes.
For the food system approach, because some people participating in the previous years, they already changed or retired, like me. So I think that firstly, secondly, at the provincial level, we are thinking about bringing the food system approach to the local. And the local also very new and a lot of disturbation. So I think that the capacity building and is really important and critical. We have some discussion with the people from ministry that and also with FAO and other that the call for international support now is really critical in order to keep the momentum of the food system transformation and also agroecology. And I think that maybe the results is not only evidence and the recommendation. We need some policy building already. Somehow we have already been, for example, integrating food system in the national targeted program, etc. And but also we need a tool. I think that methodological tool and training document is very important because a lot of policy and the government needs the training material to show exactly what we have to do with the local people. So this is the way that they are waiting for realization of the policy. And also monitor. So we have an indicator monitor for report training and after the reporting, and also finance money is important to do and to support them. That means I think that we can add not only evidence for research, we can but also the tool and
Yeah.
training material. And this kind of documentation is very important, not only for Vietnam.
No.
Yeah. With the when we can see that a lot of countries they are they also they don't test, so they are waiting have something meteorologically. I think that firstly interesting.
Okay.
And I think that we hope that BDN don't stop here and 2026 because we need more time. After that, I think that we need some to work in some pilot model at the local level.
Yeah, I agree.
Really with the results, etc. Because now we are in the stage of training, but after that, the people we need to work together with them in the change the situation. We can have some pilot model on the transformation at local level and can document this. I think that this is very important. Maybe case study or successful story, etc. Vis-a-vis the Dutch, I think that this is very interesting because recently the Dutch government have very high interest about Vietnamese agriculture. We have already the sign between two government on the agriculture and cooperation. And I think that 4 people I know, 3 of them, first one, and they already know Vietnam and food system. And something they can propose. Not they don't start from zero. Something they can propose is methodology. What kind of methodology? Because the researcher they have some kind of methodology, and they can also present share this and to see what is the possibility to apply in Vietnam or not, Vietnam context or not. I think that only the 4th one political, but I think that the policy people in Netherlands really they have a lot of thinking about food system transformation in Africa.
Yes.
Strategically.
Yes.
And maybe something we can learn from Vietnam. Maybe, yes. I think that this is very useful for the South-South cooperation. Because I know some other Netherlands they're also on way talking about Vietnamese experience in Africa, etc.
Yeah, I agree.
The second thing that interests that maybe we can keep this good opportunity to connect with Wageningen University because this is a research university and the high ranking. I think that for research university in Vietnam is very valuable, particularly for us, for example. And we can start with some research activities here, but for more long term, also for the higher education, PhD. We can maybe thinking to send the PhD student to Wageningen also, or some topic from here. We can also
that's
what is a good product. This we can have a real product here.
We need to clone.
But
we need to clone Quark.
But he need to defend.
Yeah, he needs to defend.
And after the
no pressure. No pressure.
Yes, sir. No, it's a good product between Vietnam and Netherlands, and I think that this is a good opportunity to. I have some talk with Mikael already last time, and I think that this is very good. They are looking the opportunity to cooperate with Netherlands, but don't have really. Recently, I'm invited to talk with a group of experts of Ministry of Agriculture from Netherlands for 20 people, and they are highly interested and mostly interested about Mekong Delta. Because Netherlands they have also water management, etc. Very strong in water, etc. So they highly interested about the Mekong Delta work, etc. But for example, Sigrid, I know her very well because she does PhD here with the Fresh Studio and with Malika. Just with the Pon Mutier, etc. So I also, and she has very strong capacity on the value chain and consumer research. I think that it's very good to the research here also in Malika or extra. And so I think that after the first coordination, we can talk. Firstly, the contribution for BDN. After that, Mr. Tien can, after the meeting, he can talk about maybe other
the side conversation. As long as we show something that links to BDN, I think that's the important. Okay, great. Any other comments or feedback? I want to make sure that we stay on time. I mean, we're going to have a separate presentation on CAPSHA in a few minutes, so maybe yes.
Yeah, I just add follow up with things here about we need to field model. We don't want to use the word model like the intervention.
Mhm.
Yeah, right. So there are some chance that we can cooperate with local funded projects or program,
Okay.
even with the Ministry of Agriculture and Environment, because now the local authorities and local fund, encourage the cooperation of different funding,
Okay.
where we have a very good network and experience in scientific and methodology.
Okay.
And in the field, they funded for different models
Mhm.
and different interventions. So if that's good, we can think about how to cooperate and co-fund.
Okay. I think what's interesting, the last comment here before I move to the next point, I agree. I think what's interesting is to see when we begin to work as BDN sort of at the national and subnational level, when we get to the subnational where things become much more concrete. It's very interesting to see how once the provincial teams have sort of their provincial implementation plan, their budget and their sort of their activity plan and their tracking system, it's very interesting to see if we can actually design and test interventions with them at that scale, right? And so maybe there's specific interventions around diets and nutrition, or specific interventions around capacity, or around the linkages to agriculture and consumption. I mean, we can identify specific research topics, and it would be very interesting to see how we frame those and how we frame them as testable hypotheses, and actually do that kind of work at a local level and say, okay, we recognize that there's a need to improve dietary diversity. Okay, what can we do in this specific context? Okay, we test doing this and this and this, and then we document and evaluate it, and the lessons learned can then feed back to provincial authorities and to the food system partnership at national scale. And so it would be very nice to see how we build those learning loops or learning connections at that scale. And so I think that can be done. That may be where we go under BDN for 2027 and onward. Maybe it's much more testing interventions in specific contexts to see what works, what doesn't, why. In addition to some of the other things we've done, and that would be very useful to do with local partners, and ideally with co-financing would be ideal. And we could also think about potentially bringing in local universities. I mean, I think we could be very creative, and so maybe that's a topic for further discussion. Yeah, because we know that there are many problems or issues to solve, but we don't have the solutions necessarily, and so we need to test. We need to test different ways of working and see if what we propose is effective, evaluate it, and then if it is effective, share those results and try to scale them up. So I think that whole process, once we have the framework in place, we already have the national action plan. We have the provincial implementation plans. We should have budgets. We should have a tracking system in place. And that gives us the framework within which we can test and evaluate specific solutions. Right. And it's nice because if we can do both in Son La and in Dong Tap, we have very different contexts. Right. So what works in Northern Highland, what works in Mekong, it's going to be very different. Right. The issues are different, the problems are different, but we have two spaces where that can be tested. So anyway, I'll stop there. I think there's a longer discussion, but I think that's a very interesting. Okay. So on the next point we have on the agenda, let me just see, Razmi, if you want to come in at all, just raise your hand or online and compliment. But if not, I'm gonna go to the partners. But is there anything you want to compliment at this point? We'll do the CAPSHA presentation after this next session.
Nothing at this point. Only one thing is you had asked earlier about if I knew anything related to the research and products that are going to be done in Vietnam. Fung is here now. I think she will be able to actually talk about that. That's
great. Fung, if you could give us an update on what are the publications or the products planned for this year in Vietnam, it'd be great.
Okay, thank you. So basically for publication, we have submitted 2 papers, one related to diet intake among adolescents, the second related to food eating out of home. Another two is ongoing, one related to food pattern and one related to food intake and environmental impact that is supposed to submit by end of the month.
Okay.
Of March. So that is 4 paper. Then continue for 2026, we will work one more with Vietnam paper related to the food environment. And then we also have cross-country analysis, including Vietnam, Ethiopia, and Vietnam on food expenditure, on food environment related to unhealthy and healthy diet, and few others. So I think that if needed, I can send few lines on email to summarize the Vietnam one and the cross-country one. Yeah.
That would be super helpful. Thank you very much. Unfortunately, I didn't have that information, so I couldn't include it. So thank you very much. I think it would be great if you could
Okay,
share.
thank you. Yeah.
Okay, thank you. Okay, so let's move then to the next point on the agenda, which is more of a roundtable discussion, with the idea being to hear from the strategic partners about the process of food system transformation in Vietnam, very small topic, and how are things going from your perspective, what activities are happening, if there are any upcoming events or meetings you think are important to share. Yeah, very, very simple topic. So who wants to start?
Maybe it's by just organize or meeting.
Yeah,
That's
maybe it's
the-
fine.
that's fine.
That should be first, yeah.
Yeah, okay.
It's where activity related to food system transformation. We focus on the policy activity,
Okay.
policy related activity, and we are design the task of doing the M&E. So we just continue that task.
Mhm.
So with the support from Iron Embassy, so we managed to collect the baseline data and also try to estimate the kind of hopefully feasible target for 2030. So we presented it yesterday.
Oh,
Yeah.
okay.
So and we got like positive comment from the participants. So I think we can kind of finalize the M&E at national level.
Yeah.
And we try to institutionalize it this year to put the related indicator into the circular of the ministry on the sectoral statistics.
Okay.
So of course the indicator relate to health, like and nutrition relate to the mind. It doesn't include, but mostly indicator relate to production.
Okay.
Yeah, and environment, like the emissions and the quality, the degradation, something like that. So from that work, we would also want to come to the provincial level of the near future, right? So that we match with the BDN and CAPSHA when it comes to local.
Yeah.
And also at the yesterday meeting, we also shared the idea that when we come to local, we should start first with the training.
Okay.
Maybe because we also developed the kind of manual, right? That
Yeah.
is particular to Dr. Mai, Dr. Thế Anh, and many others for comments. So now we have kind of in a good shape manual.
Okay.
And we can have something to go to the local and so also I think with the expert maybe in Dutch, the Dutch expert maybe they also can comment on the manual and how to like make it into maybe 2 days training program, something like that. And also like Hương comment that we can develop kind of flyers or more visualized material. And when the local can understand the key concept and also the international experience
Yeah.
to get some ideas, so then we can come with the small action plan
Sure,
and investment plan,
sure.
and then also the M&E for the local to measure their action plan, not the
Right.
national.
Exactly. So I think it would be very important to have a conversation about that because I see several connections. Certainly at the subnational scale. So we have this year the planning to do training under CAPSHA. So maybe we can come together there and think about how we incorporate some of these materials into the CAPSHA training to take advantage of that. That would make sense. And then in terms of the provincial level monitoring, certainly the PPDF work is focused more on process, but I think it would also be interesting to see how that connects to the kind of thing you're talking about. These are outcome indicators or? Yeah, so this is a conversation we had in the past, right? So anyway, Bruce, it might be good to have a conversation then about how the process monitoring, which is what we're doing with PPDF, connects to the outcome monitoring.
Yeah.
Because ideally, we can measure outcomes, but we actually have to manage things to change the outcome.
So we can integrate it into
Exactly.
application.
That would be very interesting. Okay, I think that's super helpful, and it would be great to see what you developed. If you could share it with everybody, that would be really, really good. It's all in Vietnamese, I assume. Yeah. Okay. Well, so you can share, and then we can review those. Yeah. I mean, yeah, my Vietnamese is not good enough, but others can. Okay. No, that's great. Okay. And is there anything else that this PAE is doing on the food system transformation work?
Yeah.
That's
Maybe we can, I'm not sure about the ICT plan for the the working group, five groups. When the
at the food system transformation partnership.
then we will have more active role in the policy working.
In the policy working group. Okay. Well, it'd be good to discuss that as well to see, because I think we're meant to provide input, but we're more directly involved with NIN in the consumption working group. But it would be good to just.
So I said that we have to wait for all the.
Yeah, so everything to settle.
In the
Settle, yeah.
Yeah.
There's a lot of, everything was mixed up again. Now we have to wait for this. Okay.
But I think the positive side that once we set up the network, then it can last for long term, 5 years. So. At least.
How
So technical working group on policy. So yeah, I think that makes a lot of sense.
under the food system.
Yep, under the Food System Transformation Partnership. Okay, great. I know, congratulations on getting the monitoring system. It's not easy, Okay. How many indicators finally?
32.
Oh, that's good. That's good. You started with what, 100?
Yeah, 150.
150, okay. Good. 32 is an advance. Yeah.
That is 9 number.
Yeah, it's gotten better. Yeah. Okay. Great. Okay. Yin, do we not go to Yin?
Thank you. I think it's very good in the BDN structure and research implementation plan. I think okay. So for the much detail in the objective and what indicator would like to outcome for the BDN research plan, I think is much more clearly by the contract for each partner. Yes, okay, I think good. Yeah. So now we going well, we prepare for the contract after start doing okay. So now is for the second part, talk about the ongoing activity for the contribute to the transformation to the food system. It's for the nutrition part. I think there's some information I would like to share with you now. I think is that because in the last year, the government and the Ministry of Health is put a lot of the change, the improvement in the government structure and including in the policy
Mm.
document related in the nutrition and health. So
Okay.
that's why I think it's a very quickly to change now. Yeah. Talk about of course related directly in the food system transformation activity. I think you talk about the what action can the influencer choose the consumer.
Mm.
So I think I thinking more about in the what. So the first I think in the I think summary now in the last year to until now I think is the very important in the government to put a lot of the policy.
Mm.
The first in the law of the preventive medicine.
Okay.
We have approval by the National Assembly already in the last December last year.
Okay.
So now is we have one chapter for the preventive medicine with nutrition.
Mm.
So nutrition in the government put in the whole country and for the whole people in the nutrition cycle.
Mm.
So that's why in the old people now we put in the from the children to the elderly people,
Okay.
including in the school and
Okay.
the labor place,
Everywhere.
everywhere.
Okay.
So that's why we focus in the for the nutrition intervention
Okay.
and the nutrition solution.
Okay.
So that's why including we put in everywhere put in the monitoring assessment, and the second is the counseling and follow in the educate and the communication for nutrition for whole people.
Okay.
So in the law,
Okay.
talk about, so that's why in the so last 3 months in the Ministry of Health to draft for the circle and the decision
Mm.
for the how to the action
Yeah.
for in the nutrition activity. So that's why now we submit first to the government. So hope that in this July or June or July, so almost in the decision and the circle
Okay.
on the nutrition action in the I think it's approval by the government. So a lot of things to change. So I think change now in the for nutrition now. I think in many action now is a focus in the nutrition intervention in the tool by the communication.
Yeah. Yeah.
Counseling just meaning communication, education to
Yeah,
the
yeah.
consumer. So I hope that in the this the law of the preventive medicine can the effective in the July this year.
Okay.
Starting so that's maybe including in the province level to keep in the budget to make the planning for the nutrition action in the whole province.
Mm-hmm.
I think it's a very quick need to change the local government can put in the money for to do that, and the action so now is to need to do. But do you know before almost is the government to guideline and the to introduction for them to do so, but in the not in the regulation and the mandatory action. So that's why now I think it do.
Okay.
That's mean I think in the very important to change now is to contribute for the to quickly to change in the change behavior, to
Yeah.
change in the thinking, the KIP
Mhm.
for consumer.
Okay.
Yeah, so that's why now in the and now we working every day to prepare for the guideline for the professional document
Mm-hmm.
to submit in the government to Ministry of Health to guideline for the whole country, province level,
Mm.
in the health networks, in the nutrition network to using document to using for the educate communication for the intervention nutrition activity in the everything. So now we quickly do every day. So I hope that in the result in the this year maybe in the more training for
Okay,
digital network
okay,
and also to renew in the document network. So document now in the NAM focus is the nutrition specific and some including now the document we put more some chapter, some parts to talk about the food system now. For example, now we doing in the one document to training for the master or PhD. We put more one the chapter to talk about the food system now. Yeah, and then now to put more. So and then after that, I hope that is a continue for the document is and stuff.
okay,
I think in the of course it's for the need I put some action to do that for the how to get in the regulation and the decision from the government and to find the resource from the government to do with the put in action from the network.
Yeah.
I hope that will change in
Okay.
this year and the next year for the contribute for the to do some action for the
Yeah.
system because now we forgot in the one in the partner for is a consumer and consumption to change behavior. So I think in the
Yeah.
policy and methodology and document. So now I think it will find more in the human resource and the party resource. I hope that in the continue to do that is from government.
Okay.
Okay, so now we come back talk about the same company meeting is a partner. In focus is this project and for contribute in the food system transformation in Vietnam now. I think now is a very how can you say the lợi nhân hòa đó. Yeah, I think it's a very
Own condition.
Yeah. This time I think very
Enable the environment
go
very
to
well.
in the Sana or Đồng Tháp now. They have a mandatory regulation from the high level.
Yeah.
So now in the very helpful for us now to do in the Cancun, they cooperation and they do activity something. Yeah, I think it's a can.
Okay.
That's why I think BDN now we focus in the document how to document it as a Dr. Thế Anh mentioned. Yeah, so in the I think quickly to release the document is a guideline for them in the how to transformation system something the DOT for them quickly. Yeah, I think so. By the way, they have a in the regulation from the government and the police province level government. So and they can quickly to do that. So I hope that in the BND can support quickly. I think in the as I talked with the Dr. Thuyền, Sơn La and Đồng Tháp I think it's almost already. So document I think is general document is okay.
Okay.
So now I think our team quickly to do in the document and then in the to testing also doing something in the so now Đồng Tháp is quickly.
Yeah.
So after that I think it's after 1 year. Hope that is the next year. Can expand in the whole country 33 province level. Of course, I think that some in the province, in the capital and the central, they can, they maybe in the pay attention something. I think another province. I think in the way we can do TOT for them in the how to in the document already and TOT for them because government now in the put in the local level and the central very quickly. So what I think is by the way to do that. So transformation that's been I think is action from the high level go to now. So by the way we are the professor level.
Yeah.
So I think it's quickly
right. So we need to work
in the document.
Yeah.
Document in the as mentioned in the document now in the we see I read more again sometime in the document is the last time. I think it's very general. So now I think specific for the action in the province level.
Okay.
Province level, do you know, is the say, okay, general information here, in policy information here. So, but I think in action
Okay.
for the action, that mean it now in the following the government guideline for government regulation now. As I mentioned, in legislation in the quick change. So I think in one again, we do in the action now and follow. I don't know about the agriculture and environment sector. So, but I think in nutrition now very quick change. So, but that's why I think now in the to divide and to get in the for the this document.
Okay.
So document now is the TOT for the province level. Of course, I think in the we can to choose some the communist level.
Yep.
Because now I think it's a communist, that's mean it's very big. The same in district level. So that's why I think now in the province level, including in the local level, in the community level also. So of course, I think in the after that in next year, we can to expand for this document and TOT. I think we could need because of doing a food system transformation to get objective in the 2030. So only I think 3 years. We need it's a lot of things. What is transformation? That's only in the document. No, not in the impact. Only the two for free. So now I think it's not going on now. So that's starting in the top in the Senate. So it's a, by the way, I think as I mentioned, is now is a very good condition. The government is put a lot of things quickly. So now I think our team is doing some in the document quick.
Okay.
So, yeah, I hope that in the by the way, doing and mentioned in the by the way, in the nutrition now in the put a lot of the document from the nutrition guidelines, everything. Of course, as mentioned in last year, we have a food dietary guideline and the tips in the consumption in the pyramid food, something in the delay already. So this year we opening the website and the app for the whole whole country for the nutrition. After next week I send you in the app you can do food for you know a lot of information to. So that's why I think in the whole site in the next week is the government in the starting starting for the health day anniversary health day for in the whole country. So that's why I think whole that is the nutrition for information and the nutrition guideline in the whole country people know well.
Okay. No, super.
Yeah. So that's why
Sounds like you've been busy.
Very busy, very busy. So I'm very happy to contribute for the food system transformation. Busy, but I think it's very effective. Outcome in the government now food every day. Yeah.
Vietnam become a star for the scaling of nutrition network.
Yeah.
On the scale of nutrition country run to
Because of this. I can imagine that.
Okay, I just try to share with you information in the ongoing activity in the some activity indirect, some activity directly.
Yeah.
So I think it's almost in the food in the outcome for the system.
I think that's great. And again, it seems to me, listening to both what Isbaye said and what you're saying, Dr. Mai, is that for the CAPSHA work, the training of trainers, we need to make sure that all of this information is incorporated. Because that's a great opportunity to support the training and capacity building at the provincial scale.
Yeah.
So we need to make sure that that's something we need to flag for Krista and the CAPSHA team.
Yeah.
Make sure that they include all of the updated policies and information. Yeah.
So I think that's one we need support because in the contrast, you also mentioned well. So in that time, just much sure how we have the meeting across the panel, upper degrees and the CAPSHA, we can talk more.
Okay, that's fine.
Yes.
Okay, thank you, Dr. Mai. Very interesting. Okay, let's see, coming around the table, I guess.
Okay, yes, the two things. First thing, I would like to inform about the ongoing under the BDN program from the VAST team.
Yeah.
You know, the Sơn La and he's the first province. They have the action plan for the food system transformation, and we have done something from that.
Okay.
You know, we organized a meeting in the last year, and then we try to collect some more information from that and try to set up the network for food transformation system in the Sơn La province.
Okay.
I started with my team that we have done in Sơn La, contribute in Sơn La, and Đồng Tháp need to be focused on another two provinces.
This year.
In Vietnam.
Okay.
Just submit that. Okay, that's the program action plan is very good for the provincial level because they have overview about what they have to do in the food system transformation. But we have Đồng Tháp is very typical for the Mekong Delta. Sơn La is very typical for Mountain Air. What about the middle?
Exactly. That's a very good question.
And then in the flash area, the city and whatever. That's why we need to try to submit something.
Okay.
To get support from them, but I'm not sure about that. But I suggest them to do. And we also, we also participate in many programs. But we learn from this technique, this program, the methodology, approach, methods to discuss with them. And like we involved to some program in under Ministry of Agriculture and Environment, like food system transformation and soil health and plant nutrition management. And recently it's low carbon growth production.
Okay.
And the third thing from the BDI activity is we are ready to sign the CAPSHA contract. Yes.
Razmi, I hope you're hearing this. They're ready to sign the CAPSHA contract.
And you know
it is with them actually right now.
Okay, we prepare something for doing the contract soon. All the activity we did in the past now serve for that contract. And the first of all, I want to say something from VAST, what we want to do, contribute to the BDN. I think that in the future we have to have the very strong collaboration with NIM because we focus on producer. We have focus on producing the agriculture product and they focus on consumer. Yes. And that's why we have the gap in Vietnam between that. And what we have in VAST, what we care, we are now put in very high priority for the food safety, especially like the heavy metal contamination in the agriculture product. We are facing with too many things like the cadmium in durian in last year. And recently, I sent to you some papers.
Yeah, I saw it.
So we have the new one. We set up the group to focus on the selenium in rice. The selenium is very important for the human nutrition, and we focus on that. And we continue to evaluate the cadmium content in the durian and how to solve that. And heavy metal in fruits and vegetable in Center Highland and in some other intensive agriculture product. And that's why it's one of our topic we put in priority. The BDN is very, very, very large, very big thing, and everything we can link with that program. I'm sure.
It's dangerous. It's dangerous.
I'm sure. We have to select something. We always talk about the policy. But when we talk with some policy, they said, "Do you have any evidence for that? Scientific evidence for that?" And that's why we need to do something step by step. And that's why. But we based on this program to look back and to decide our scientific research. And that's why it's just sharing you some information.
No, super. No, they're very interesting. Again, I think it would be ideal. The initial theory of change for the work in Đồng Tháp and Son La was that these would be pilots. We would learn, we would develop methods and tools, and then they could be taken to other provinces. So very good to have that conversation about Central Highlands or one of the central cities, whatever makes the most sense. Because I think that's precisely the idea. The idea is how do we help promote the development of more provincial implementation plans so that things can move faster. So, and the link to nutrition, I think is also very, very good. We have, I mean, outside of BDN, but within CF, we have people who are working on some of the issues around heavy metal as well. So again, that's maybe a side conversation. And so I know they're working on rice. They're working not just on selenium, but they're also working on arsenic and rice.
Yes.
And they're working also on cadmium in tree crops. So
Yes.
mostly cocoa, but I'm sure it's similar to durian, right? So anyway, we can, that's another conversation to have.
Okay.
Yeah, but I think definitely let's see how we can think about the expansion potentially to other provinces as it makes sense, right? Because I don't think we would lead that, we would support,
Yeah, yes.
but we have methods and tools we can use. Yeah. Okay, so now we go to
Yes,
big boss.
thank you. But I'm
You're not
the
officially a strategic partner, but you're an emeritus strategic partner.
I'm the new player in the game.
Yeah.
Because the final is not yet a strategic partner.
Yeah.
Firstly, we can see if we can propose a MOU with SIAT or not.
Okay, we'll have
To
we'll have to see.
for the
I don't know if we. I don't know if we
institutionalize
know each other, if
the
we know each
cooperation.
other.
So yes, we are the substitution force. So currently, FANO is we are the network of scientists or some voluntary. So we have some surplus, some easier mobilization of people, easier than the official institution. Currently, FANO we work more with agroecology that related to also to see how to produce and supply the nutrition and healthy food. I'm now leading a network named Alicia. So we are building knowledge hub, digital knowledge hub about agroecology. This is a regional one, including Vietnam and Laos and Cambodia.
Okay.
So I think that different we propose to BDN maybe we can open a chapter on the tool for food system in this kind of digital and for promotion. We are developing the version in Vietnamese because the regional is originally English, so maybe have some limitation for some Vietnamese, mostly farmer cooperatives that they cannot consume. We are pushing for Vietnamese version for. We also thinking about how to connect with consumer. Dr. Mai talking about communication is really important on nutrition and what is a healthy diet. We are thinking in our group is to see how to recognize agroecological product or healthy product, because she suggests that agroecological product can contribute to the healthy with some kind of participatory certification. That means we need to win the indicator and also to make the consumer know about the product and buy. So this is very important. Market incentive, because we have a network of private sector in our network, so the private company or cooperative, not only research. So I think that this is secondly, FANO is in myself. I continue with the National Food System Convener, so I facilitate agroecology working group.
Okay.
Under the national, so we have 3 working group here
Represented.
Nutrition
Policy.
and I think that the contribution of our research is very important to. So maybe I have to support general. This is being for the food system coordination in general.
Okay.
And connecting with the international communities like ICF. Etc. Because we are member of ICF and also food system coordination hub, and they have a question, we have to respond fast and accurate. So this is the question that we think about communication, because in FANO we have a journal, so online journal. So I think that contribute to the communication about food system, etc. So I think that it's also very important to push up.
Okay.
And even now we have to wait the officialization of the food system partnership because the process from ministry is only a little bit slow. Yeah. But I think that behind this we have to continue to facilitate the exchange. And I think that firstly we are thinking about the invitation, different organization to join also agroecological working group.
Okay.
We have some part of SIAP is Bambas, maybe
Carlo and his
Carlo, yes, the
multifunctional landscape.
multifunctional landscape is also.
But our team also in the market incentive.
Yeah. No, I think we're in.
Maybe some activities that
We're in many different
can
working
invite your program to join, for example, market incentives, etc.
Sure. No, that would be great. That would be great. Because that would connect to the MSME work. So, you want to say something?
Yes.
And myself was the last activity
Maybe we need to
before
discuss
passing to
also.
yes, hand over to her. That I'm also start to give some lecture in the university about food system.
Ah, okay.
At the national Hanoi National University on master degree on sustainable science.
Okay.
And then I insert the food system and also in the USTH is a French University of Technology, the Faculty of Food Science.
Okay.
So in general they teach about food technology, but I insert a socio-economic chapter on regulation, food system, etc. So I have to take the document from nutrition from Dr. Mai and learning this and retransfer to.
It's okay. I mean, I think
so I have to learn myself first.
Exactly. But I
talking to students.
But I still remember being in workshops where you were presenting nutrition and you were presenting agriculture, and I thought this is great. So okay.
Okay, actually, I say 3 points. Very happy to share with you. Is the first talk about the monitoring the indicator outcome of the food system now in the after the law of the preventive medicine. We have one circle talk about the nutrition surveillance.
Okay.
Indicator. So that's why in the some indicator now every year we can to put outcome, including in the percentage of the children for the malnutrition, percentage of the overweight obesity in the adult people and the school. So that's why I think in the focus in the food system in the by every year for the reducing or the increasing in the percentage, I think good. Put more in the one indicator is very important in the diversified food score for the pregnant for the productive woman.
Yeah. Okay.
So that's why I think in the important for put more outcome of the food system in them. So every 5 years we have a big national nutrition survey. Put more in the some indicators. So but now I think in the submit for the indicator. So using in the digital collection.
Exactly.
So that's why I think in hope that in the last year in the very big trend for the reducing system. So that's why I think
That's a good area to collaborate. Yeah.
yeah, so by using in the province local level passive in the support for the to get last year. The second talk about the food safety, I agree with Dr. Tien. Because I would like to change behavior for the consumer, we to lead the food safety. So that's why in the now we educate a lot of talk about the diversified food in healthy food. So what is the concern about the food safety? Big problem in Vietnam now is a very big channel. Big channel for the how to change action for the to eating diversify now in the I think Dr. Remember for the FONS project, we find very clearly in the big change. So now in the government to quick change for the ZY again in the law of the food safety. So, but I think in the to put from the production to the eating table, so that's why I think I hope that for this change, for us maybe in the to keep for food system, we can to do in the to raising in the high the eating in healthy diet for the consumer. So that's why I think it's important. The second, I hope that in this year in the law of the food safety in the to quick change a lot of things. The one point I would like to talk, as I mentioned, Dr. Thế Anh, now in the how to in the Vietnam now in the food system in the starting, but I think doing a lot of things from the now nearby the 5 year. So that's why Dr. Thế, I said Dr. Thế now is we can to quickly doing in the really some the report and to talk more about the story of the food system transformation to put including for the information something. But in the Thế Anh, as mentioned in the plan and education, I think you can do support for the Thế Anh more final meeting for writing paper, writing in the many things. I think very important. To change because of. But I think it's important because of nutrition. We have two plan of the scientific plan of the nutrition. So, but we talk for the research, not can talk.
Yes, the
about
scientific
journal. So that's why, I
communication for communities.
Yeah.
No, I think that's a very good point. Yeah.
3 point is thinking more during the people who go to the CAPSHA grant next year. Yeah, okay.
Maybe we go for CAPSHA first and then we can continue.
Yeah.
That's
Okay.
Okay.
Is that okay?
Yeah.
You sure? You're not going to die?
Yes, I'm
Okay,
happy.
good. Oh, you're happy. Okay, good.
Yeah, a lot of food.
Yeah.
Yeah.
A lot of food. So she's happy. Very happy. Yeah. No, I think no, this is all really useful, and I think yeah, lot of food for thought. Yeah, I have lots of ideas, but let's finish this. Yeah, no. Okay. So I believe Razmi is still online as well, so that's great. We prepared a very short summary. I think many of you are now very aware of the CAPSHA project, but I just want to share with everyone so we're all on the same page. Razmi is the official PI of the project, so it's good that she's online to help answer any difficult questions. Razmi, I will just point to you. I will answer the easy ones. Okay. So basically, you should all be aware of this, but I just wanted to give a quick update. Again, this is the goal of the CAPSHA project is to work on these three core activities. The contextualized TOT. The second is the framework and methods to track transformative processes, which is where we've been doing the PPDF work, but it needs also to link to national scale, so we have to think about that. And then obviously a peer learning network, which has very limited money, so it will be a virtual exchange. We don't have money for people to be traveling, I don't think. So those are the three core activities. Next. And what I want to go through here is just I have to click. Yeah. Okay. No, go back. Okay, there. So these are again, you've seen all this. This is what's proposed under the TOT. What I think we need to do based on what we've already discussed is focus very much on the updating of the training materials based on all the information you've just shared. Because I think things, as you say, things are moving very quickly, certainly in the nutrition sector, but also in other sectors. And so we need to make sure that the training of trainers' materials are up to date. And so that's a collective activity that we should do together to make sure that these materials are useful for the CAPSHA project, but also beyond. So these materials will be in Vietnamese, so they could be used very broadly. And so it would be very, very important to make sure that all this information is in the CAPSHA materials, okay? So that I think is important. And then we'll talk about how we go through and we'll do more detailed planning about the learning cycle and everything a bit later. But the key lesson here is let's make sure these materials are up to date and as useful as possible for the people we want to train. Next. So here we have again, the responsible people in this. So the lead for the co-development and of the TOT is Ispae. I know you have nothing else to do, so this is good. Lots of free time. Yeah. So Ispae, but then we also have obviously contributions from VAS and NIN. So again, the idea here is and the alliance will support or CIAT will provide technical backstopping and support the process. But we will be working under the leadership of Ispae and in collaboration, obviously, with Wageningen. So we need to triangulate information from country into training materials with Wageningen and then rolling out to the training of trainers. Again, we will go. We don't have time today to do detailed planning, but that will be the next step. Yeah. So that's where we are. And I think it's very important that we take advantage of this opportunity to update the materials and make sure they are as useful as possible. Okay, next. The second one, again, just you can click through all the, The second one, I don't know why it's this anyway. So the second one, again, is to complement the outcome focused analysis. So we've already heard from Ispae is going forward, which is great, with more of a method focusing on tracking process and process management. And so this is the work that we've started in Sonland on TAP with the PPDF, which Brice has been helping collaborate with many other people on to do. And the idea here is very much to come up with a final tool. And again, Brice can share more details, perhaps not today, but we can have more details about the content. And we can see how we can adapt that to complement the outcome methods. And the idea is very much to come up with a pilot framework and methodology that we can use. We can test initially under CAPSHA in Sonland on TAP, but again, could be used across many other provinces, I hope. Next slide. And again, here we have the lead again is Ispae, because they have lots of free time, with support from the Alliance. And in this case, it's principally with working with Brice and others. And basically the idea there is again to continue to develop and refine the PPDF that we've been working on. And finalize it, because we've done, Brice, correct me, we've done of the 5, what's the matrix? It's
5 policy stages and 6 principles.
Right. So
we did 3 policy stages and 5 principles.
Right. So we're still missing some of the policy stages and the principles. So we need to complete that effort and come up with a final tool that we can use both here in Vietnam and also share. We need to share this with Ethiopia and with Bangladesh as well. So we've already had an initial conversation with our colleagues in Ethiopia and Bangladesh, but we will need to provide this information to them. So again, both make sure this works here in Vietnam, but then also share for work in Ethiopia and in Bangladesh. Okay, last one is the learning network. Again, on food system transformation. Again, this activity ended up with a very limited budget because of changes in overall budget to CAPSHA. So what we propose to do here is, as the team here in the country, the CAPSHA team here, let's try to organize or take advantage of some of the existing networks from training of trainers that we built earlier. So we know that there already is a network of people who've been trained, correct? Head lead trainer, trainer boss. Okay, trainer boss. Okay, so trainer boss. Yeah, so trainer boss can tell us all about that, but we know that there are already networks on Zalo and things like that. So the idea is to be very pragmatic and say, how can we build on things like that but do it in a more structured fashion? So how can we identify areas of common interest or concern or issues where we can generate exchange and use it and take advantage of the existing networks, both the tools as well as the people, because we don't have a lot of resources to do this. And then we would try also to document this process in Vietnam to share results and lessons learned, again, with Bangladesh and Ethiopia, who will be building similar systems. Okay, so that's basically, I think there's another slide in terms of responsible people, and there are arrows and lots. This is very exciting. Okay, here we go. And so this is the way it's structured here. This is currently going to be led by Razmi from IFPRI. And basically we're responsible here for leading the Vietnam component. And I believe on the Vietnam component, it doesn't say it here, but I believe it's with us, right? Yeah. So that would be more or less what we have planned. So next slide. These are the outputs. Again, I don't think we need to review them again. We know, we probably have them memorized by now. We've seen these so many times. This is what we need to deliver by September 2027. We probably need to deliver them a little bit earlier, some more like July, June, July, so that we have time to document and put them together to share with the Gates Foundation. So that's the discussion. Maybe Rasmi can give us her thoughts on that. So we probably need, the final deadline to submit is September, about 2027, but we probably need to do finish a little bit earlier to get it all ready. Next. So these are the next steps that are proposed. I know I'm very happy to hear that things are moving forward with the partner contracts. Now we have the good news from Ispae that it's signed, that it's under review and will be signed hopefully at some point by us. And with NIN, I think it's also under review. Yeah. The contract.
We signed already. We
you
have the contract.
Oh, you signed already. Okay, good. How nice of you. So that's the first step is obviously to finalize the contracts, which I think are great because they're ready for signature. And then based on that, we would hope to get that finalized by the end of, somebody take a picture. Somebody take a look. It's signed. Look, Rasmi, I have a signed contract.
Yay, big accomplishment.
Yeah, very good. Well done. So we have the signed contract from BUS. But the idea would be to get all the contracts signed by the end of this month, right? And then we can develop a detailed implementation plan with timelines, just a detailed plan so we're all clear. We would like to have that by early April, like the half April, and then start implementation as soon as possible afterwards. So second half of April. That's basically where things stand. Rasmi, I don't know if you want to compliment anything. That's what I had to share.
Yeah, no, thank you, Mark. This has been super quick update. One of the things, as I was hearing from all the partners and what they are doing, I think it would be helpful to actually have a kickoff meeting, and that's what you're saying. But I'm just wondering if we need to have one meeting with all partners in the room, but also with individual partners. I mean, I would like to hear your thoughts on that because with each of the TOT, the materials need to be revised based on what I heard from Ispae that they have already collected some data, how that fits with what the current TOT is designed, and then what VAS is also doing. How do we think about that? That's my question, actually. Do we have, because, and a kickoff meeting, which will develop work plans, in-depth work plans will need some time. So do we bring everyone together, sit through everything, or do we do that individually first and then have one meeting where everybody shares? And at what point would the Netherlands, the others, that thing comes into picture? Is that going to be something separately developed? Or would that also be part of this work?
Are you talking about the senior experts?
Senior experts, yeah. So would you be doing that separately? Or because the partners are going to be the same. So I was just wondering about that.
But the senior experts are more broadly in support of BDN, not specifically or only CAPSHA. So I think that's a separate conversation.
Okay.
Okay. So, oh my goodness. So I think, but what I would suggest is, let's hear what people think. Is it better to have one meeting with everyone to do the CAPSHA planning, or is it better to do individual discussions? Training boss, go.
Before going to your questions, I just have comments. It's guide how to implement the activity in CAPSHA as well.
Yep.
So first, I checked with my teacher on process documentation. We have 5 steps and 6 principles. And of course, this year we have done with 3 steps or 3 steps. So I wonder in 2 years, beginning from April until September 27, whether we have enough time to go with the other 2 so that we can complete the cycle, so that we can have a good documentation for the process, my first question. And for the TOT, yes, of course, we are so proud of your team, the were experts in providing a TOT training in different levels, 1 and 2. We had experience to have a rollout activities at TOT. But of course, in each stage, in each step, we need to have something new and add something to make it localized.
Yep.
I mean, the material of training should be localized. And the methodology and process and the detailed content to make it more localized, and especially with the participation of the local stakeholders, more important for us to make sure that that is not the material containing lots of theory and lots of few information. That's what we would like to do.
Yeah.
We would love to see, and we hope that we hear the similar plan or question from us that we have the support from work like before.
Yeah.
So now I answered your question and opinion from myself that I suggest that we may have an individual meeting to set up because the roles are vast and each party is quite different. Although we have to link one TOT in at least one province, but it might be slightly different from each other. And finally, we have to combine into the material, TOT material. So that's what I suggest, that we can have a more detailed discussion with work. Yes, thank you.
Okay, so you would suggest doing the meetings 1 by 1?
Yes.
And then we come together to put together the full thing. Okay. So I'm not going to try to answer. I think the localization comment is good.
Anything we will.
I think the localization comment is good. It would be good to understand, well, what exactly needs to be localized and how much, because I think that also is going to have implications in terms of the level of effort needed, right? And how quickly we can localize.
Yep.
So it's good to just, maybe that's a discussion when we have the bilateral meeting. And then let me ask Bruce, what do you think about the PPDF comment? Do we have enough time to look at the other aspects?
From the beginning, when we started to design the framework, we kind of put aside the last policy stage, which is policy evaluation, which is included in most of policy cycle adaptation of the framework. So it's there in the framework, but we knew from the beginning that we would not have the time to look at it, and also it's slightly out of our scope, and like policy evaluation is a big piece. So we did not have the pretension to address it in the PPDF. This is something we can discuss overall. How do we address that?
Yeah.
But that's true that if we want to be realistic, by mid-2027, we'll probably don't have the time and resources to apply it at least. We could still think together about indicators, indicators, but to apply it would be tricky. Also because the implementation of the plan is just starting, so doing an evaluation 1 or 2 years after is probably too premature. For the 6th principle, the transformative aspect, we also need to design the indicator, but I believe it's feasible. So basically, we would add 1 stage and 1 principle by next year. So that's doable, I believe.
Okay.
And maybe just 1 precision, because I know that you might not know. So after you share the provincial report from Domtas and Sunlight, so I worked on consolidating report that I will share soon. I'm just waiting for feedback from colleagues, and then I'll share again with the rest of the team. We can move forward.
Okay. And I think the other question you had was about the connection to Wageningen. So there, I mean, I don't know, Razmi, I mean, do we want to discuss what, I mean, you have a better sense of the scope of work than I do, I think. Do you want to discuss where that stands with them? Is that signed? Is that, what's the status of that?
We are working with them on their scope of work as we speak, Mark. I think it's right now with PER for their review, and once that is done, the contract will be in.
Okay, we did receive an initial presentation from WER a few days ago on how they would hope to at least do tracking of the like the results of the training of trainers. That's still a point of discussion. I think it might need to be simplified. But there is, I mean, they are thinking about all of these things, and the intention is that they will come in and provide direct support on the TOT adaptation materials. Obviously not in Vietnamese and hopefully not in Dutch, but I think, you know, you can put them into Vietnamese afterwards. Yeah.
I have one question, Mark. As we think of the individual meetings with partners, should we combine that with activity 1 and activity 2 so that we see all that holistically, and also looking at the timelines to see what can be accomplished, because it's the same partner doing all that, both activities. And also to think about, as Breeze was talking, and the part, I don't know the name, who was mentioning this about the time frame, whether it will be finished by 2027, the whole thing. Is it possible to think about what is the maximum that can be looked at from the PPDF perspective, and what is the minimum that we can think of? What is the best case scenario to see, and then what can we get within the time frame? So also thinking about what are we missing out, and are we and how that can be captured, perhaps beyond the timeline of this grant, if the partners are would like to take it forward. So if those kind of discussions, if we can have with expand with both activities together with partners, that would be helpful. Okay.
No, I think that makes a lot of sense. I would suggest that when we speak with the partners, we cover all 3 activities. Just because I think it's important to make sure that everybody's on the same page. The 3rd activity is mostly, I mean, it's basically with VAS, so we'd have to talk about that with VAS particularly. And obviously the key leadership for activity 1 and 2. We have to make sure. I mean, it's with this SPA, but also VAS has an important role in activity 1. So I'm hearing. So are we okay with doing individual conversations then with each strategic partner and then putting it all together? Is that, I'm seeing people nodding here, just Razmi, because you can't see that. I see some people nodding their heads. So I think that's perhaps the way to go. And then Breeze, what do you think? Could we come back with an idea of what is the best case scenario and maybe the worst case scenario for PPDF? Would that, you know?
Yeah. I mean, that's not very common to do that, right? We will have a project timeline and we try to stick to it.
Right. Yeah. Okay. So is that Razmi? Is that all right?
Yeah, that makes sense.
Okay. Okay, good. So I think we have generally an agreement. So the next steps we will have, we'll have individual meetings with the 3 partners who are involved in CAPSHA. We already have we'll have when the contracts are signed, we'll sit down and have a detailed planning. And then
this will lead to a lot of time consuming if we do like that, because we see clearly there for activity 1, the lead is by but contribution we need and also what. It's better to do by activity, much sure to have the lead enrollment is better to consider also with the timeline for me and vice to contribute. Otherwise, you know.
So you would suggest
back and forth.
Okay, so you would suggest 1 meeting by component or by, I mean, really 1 and 2 because 3 is much, but not.
But even not much, but let's set up the timeline so our partner can make sure they can arrange internally.
Okay.
So they can be well prepared at the beginning for
a counter proposal.
Because, you know, because for example, a training duty leading is fair, but we need to complement each other. We cannot just you know, separately, and I will stand here and then run around, you know. it's better
You
to
don't want to run around and around? No.
very complicated. If we talk here and they say, yeah, Israel can be busy in April and then was busy in May and then Nim busy in
Yeah.
June. So that will be in trouble,
Okay, so the counter proposal is we try to have a meeting between the three partners by,
By activity,
By
to make
activity.
sure we have lead enroll, the contributor together.
and we're all
So
clear
we
on
can
what's
do
being
your
done.
timeline.
Is that okay? Yes.
Yeah, and one thing, because we understand that the TOT activity is based on the material that we are developing. So I said, yeah,
Which material developing?
already we have a material.
Ah,
right?
yes,
But
we have a
need to
customer.
adapt.
Yes.
We need to update.
Revise,
And
we need to
update.
update. So it may take time to get there.
Yeah.
So I suggest that we may very quickly to set up the
Yep.
meeting among the
Yep.
partners to agree on material.
Yes.
And then
Do we-
Right after the contract.
yes, and after
Finish,
that,
and we
Do
go.
we need word involved in
This
that?
week is the contract is signing.
we need.
Only waiting.
Okay,
So
so
what the bus and.
It's back already.
it's by, I just saw it. It went away. I just saw it. Yeah.
Okay.
Look, it's signed. Here's boss.
It's signed. I think it's start because as a mentioned, I
Yeah.
think it's a start. Yeah.
Okay.
Reviewing,
We need
documenting.
more.
We need, so Razmi, we also need Wageningen in the conversation, certainly around the TOT. That seems to be the consensus here.
Okay.
So, and we, I mean, maybe you could reach out to Krista to
Yeah.
see if she's willing to have a conversation while the conversation is continuing. Because if we wait for the Wageningen contract to be signed, I hope it will be signed quickly, but again, I think we'd like to move more quickly on here in Vietnam if possible.
Yeah, I understand. I will check with Krista because the other thing is we are also talking about the learning approach, and I think those discussions also need to happen around training, etc. So Burr has to be at the table. Let me get back on that.
Okay, thanks, Razmi. Yeah.
By the way, it does mean, I think I would like to suggest in the one point from the NIN. Because the NIN administration and the financing section is would like to suggestion in the IPRI administration would like to comment for the estimate budget or the document and the concept note or something. Yeah, I think it's a one time for some subject. I don't like is a many times. Take time is a in already very finished so then invite in the one again subject. Because in the government now is very in Vietnam busy is one subject in one time.
Yeah.
For whole in the document in the CN and the budget time now is operate.
Just one time.
Yeah. For procedure and document something is again one time.
So
The take time I see in the take time in the 3 or 4 months.
Yeah.
So only in the subject in the Z-by subject in Z-by is a take time. You don't like that because of sorry. Today I would like to talk more about it because of the next time is the next project and the something in the EP the can to divide the effect in the administration
Yeah.
from the EP. Yeah, thank you.
Sure. Razmi, did you follow that? I mean, basically the comment from Dr. Maya is let's try to avoid administrative ping pong, where we send something and it gets sent back with a minor change and then they submit it again and it gets sent back with another minor change. And so her suggestion is let's try to reduce that as much as possible. Yeah, that's the comment. I think that's the comment. I don't know.
Yeah.
I don't know what your reaction is to that.
No, I mean, point well taken, and we know it has been quite a bit of a back and forth, and my sincere apologies for that. But there is a processes at that finance system follows, and I have very little or negligible control over that. So we will try our best to not repeat this again.
Okay.
And thank you for your patience.
Thank you.
Okay. Thank you. Okay, so I think what I'm hearing is that the next steps on CAPSHA, I don't know if there are any other comments from anyone online, but if not, I'll just summarize again the next steps on CAPSHA, and I think we can then go to any open conversations or discussions people want to have Does anyone else online? Jeff, do you want to add anything on this conversation?
No, I'm good. Thank you very much. Hi, everyone.
Hi, Jeff. Okay, great. So just to summarize, we will have, once we get the contract signed, which will hopefully, we have 2 of the 3 signed. Once the contracts are finalized, we will convene a discussion session for each of the activities. Yeah, components. For component, the TOT, we will involve definitely Wageningen because of their needed to be there. They need to be there. For component 2, I think we can handle that here. I think internally, because it's basically with between the alliance and the partners. So I think that, or CIAT and the partners, we can do that. And then I think I was just at the third component. We can also probably do as a group, and it should be fairly straightforward, the learning network, because it's not very complicated. So that's the idea. We try to organize those in early April, and then hopefully again try to get the activities going by late April. Okay, is that okay?
Yeah.
Yes.
Okay. Everybody seems to be saying it's okay. Okay, so that's the CAPSHA discussion. We now have space for other kind of discussions. If anyone wants to discuss any other points, I think we can open it for that. I don't know, based on what we've said previously, if there's anything anyone else wants to add or build on, now would be a good time. Again, I think it's also important we discuss maybe when the next CCU will be, maybe an idea, not a specific date, but an idea.
Yeah.
An idea, maybe in 2 months, 3 months, I don't know.
I don't think 2 months.
Okay,
We
whenever.
will not have a lot of progress after
Okay.
2 months.
Okay.
Let's say like 3 months, maybe because they will have the beach holiday at the end of April and early June, maybe May, and maybe let's do something May or the end of May or June.
End of May, early June for the next
So we
CCU.
hope that at that time we can have some procedure on board and have some more progress.
And then advancing the CAPSHA work and on the other projects. Okay. Does anyone else have any other comments they want to make? I mean, again, we're having a very good discussion about food system transformation in the country. I don't know if there are any other topics anyone wants. I had one comment for Dr. Mai quickly, and I'll take advantage of this. Yeah, no, with one of the things that I think is interesting to explore, as you mentioned, the role of the health sector. I think it's very interesting to start thinking about how we can begin to connect health data with, specifically health data with dietary choice, right? And how we can begin to connect that back to food system, right? So can we identify specific population? I know that you've done a lot of work in the past, obviously, identifying specific populations that suffer from malnutrition in terms of wasting, stunting, micronutrient deficiency. But it would be very interesting to say, well, can we do that also for overweight, obesity? Whether that be geographic or by age group or sex or whatever, and begin to see how we tie that back to food environment and what's available, affordable, promoted, et cetera, and how we can begin to look at that kind of analysis to again make the connection more clear between health and diet choice and food system. So I was just when I was listening to you, that just came into my mind. I thought this was something we should. Yeah.
So by the way, I think you're using the data from the nutrition survey.
Yeah.
And excellent teams.
Yeah.
Another in the quality project for the environment schools.
Yeah.
I think you continue to analyze it to find out some indicators elements and
Okay. So I think that would be useful going forward, because then that allows us to think about targeted interventions that actually speak to these issues going forward.
Dr. Phil, give me to analysis to find out some interesting.
Okay. Because that was my only comment. From you, I know you've been wanting to make comments. Go ahead.
Yeah, so actually, it's not a comment. I just want to share one thing.
Only one.
Yeah.
Okay.
Maybe one.
And the audio from Dr. Datia. Now we try to work out and to support the multi-stakeholder collaboration, right? From national to sub-national levels. And we are talking about how to link agriculture and nutrition together. But there is another section that we found from different plantations and working with local partners. where I believe that it's strengthened by the government at different levels.
Mhm.
That's tourism.
Okay.
Yeah, because in Isola, for example, they have a very bold idea of how to connect the agriculture and tourism
Okay.
in terms of agroecology strengthening and especially local food, because local indigenous food contain a lot of value, including nutrition and balance and food identity as well.
Hmm.
So it can attract the tourists,
Mhm.
and somehow it's linked to new rural development where the government has a lot of policy supporting tourism in rural areas and in building agricultural tourism where we can have we can see local foods there. We can see agriculture in terms of agroecology agriculture there, and also the service, the tourism service is typical for the territory
Yeah.
access.
Mhm.
So I'm thinking where if we work with Sunlau or mountainous area, we may come up with the local food system transformation so that it can contribute to the knowledge by the end of the day, by the end of CAPSHA project.
Yeah.
That's what we are thinking. And of course, in Mekong Residential, we also have a different strategy, maybe low carbon or something else. So I'm thinking about two reasons that we are going to work in CAPSHA project, that we can dedicate to the material, we can dedicate to the methodology, and also to bring up the how to say the characteristic of local food systems.
Mhm. Okay. No, I think all, yeah, we can to be discussed. I think we can discuss all of these issues. I think we need, when we think about what local food system transformation looks like in different contexts, it will be different, right? And so I think these kind of connections make sense. At the end of the day, you need to think about how the food system can be sustainable, the transformation, and how it can deliver. Our interest, of course, is that it delivers sustainable, healthy diets. But if you know, if the obviously income from tourism or diversity on farm or on the plate because of tourism, all of these issues could potentially have connections. We would have to explore and see what makes the most sense. Yeah, very good.
Okay, continue. Yeah, because imagine the trade-off that we have been discussing, that when we produce good food, we hope that the farmer can get high income, but it's not going to get there.
Yeah.
So combining different values, different sections, different purposes of the food production can target and can end up with different values. So that's what the government is now supporting to direct the rural development as well. So food is not only for eating, but building the environment for landscape, control and maintain, and biodiversity, conservation, etc.
Right.
So we hope that we can.
It's multifunctional, has multiple functions. Yeah. Okay. No, I think I think again, I think what we want to try to do with the CAPSHA project and with BDN in general is provide guidance on how to promote these processes in specific contexts, but always recognizing that the context matters.
Yeah.
And what makes sense in Sonla may be different than what makes sense in Dongtap, which is fine. At the end of the day, BDN is trying to contribute very clearly to sustainable, healthy diets. So how you achieve that might be different, right? And so how you achieve that in one place is different than another, but that's what we want to measure our results against, right? So I think that's, you know, that gives us some flexibility to explore these options. Yeah, I mean, low carbon in Mekong is another conversation with the connection to climate, and climate mitigation, particularly in this case with low carbon adaptation and mitigation probably. But we'd have to think a little bit more. What's the connection between that kind of an approach and diet, you know, and sustainable, healthy diets, right? So again, I don't think I mean, we need to discuss. I don't have a great answer right now, but I think we would hope to be flexible enough to cover these different contexts, but always making sure that the end result of better diets and nutrition is effectively people consuming sustainable, nutritious diets, right? Healthy diets. And so how we get there, we can be flexible, I think, yeah.
So I think it would
Mark,
like,
I have
Yeah, Rasmi, please.
I have a question. I mean, related to what the earlier comment was. So are you looking to understand how what gets produced reaches the plate of the consumer, while also supporting what the farmers need to get? Is that what you're trying to understand?
Yes, very good question, but I try to explain the context in mountainous area. We understand that in Sơn we have a very good example of exportation. For example, fruit exportation, vegetable, coffee, different products, agro product exportation. However, the nutrition, malnutrition, and poverty are still there, especially with ethnic groups. So in mountainous area, besides good practices in production for exportation to meet the consumer demand, there is another demand of the local people in nutrition and in making environment, protecting the environment, because we have a lot of challenges when we develop monoculture for exportation, for example, soil health and other things. So from consultation, different consultation, 2 years continuously with CR and with ICD and ISPAI and VAS and NIM team, we found out that nowadays in mountainous area, we need to balance. We need to consider different, outcome of the food system so that we can come up with the local context, food system transformation ideas, and that will mean a lot to contribute to the food system framework, and also we are thinking about the material, the training that we can revise and adapt can be used by the local partner as well.
Okay. The reason I asked is because under a different, in an early, before BDN, there was something called CAPSHA, in which there was a local food system level assessment that was developed, and this was implemented in India, Bangladesh, and Nepal, in 3 other countries, where whatever was being grown, how that is actually reaching the entire food system was mapped at a very local level. But that was more of a research-oriented data collection project, and hence I was trying to understand what you are saying, how that fits with what CAPSHA can support you in accomplishing what you are thinking about. If you're looking for any of those, that kind of tools, they are available and we can share. And I mean, if it would be of use.
That's great.
Thank you
so much. Thank you.
Yeah, it'd be great, Rasmi. Thank you. Okay, any other comments or thoughts?
The video.
Huh?
The video.
By the way, talk about the food system for the in the using the tourism for the increasing income and so I think that's maybe is a very good idea. So, but I think that's maybe we can to separate in the different topic, because we can I understand in the Dr. mentioned. So, but in the for the by the way the framework of the food system here, maybe we talk a little more about the contribute for the increasing something in the of course I think it's a during in the TOT document, maybe we can do for some the outcome for if you to change in the system transformation in the local level. So
Okay.
I think in the Vietnam, I think need in the set up in the one model for give in the submit one project in the doctor and some here we thinking more about this point.
Yeah.
I think good idea because now I think in the some people in the some another for example in the another NGO or the UN something. I think put more how we can think about this.
You can ask maybe
the,
ICF.
yeah.
Another sources.
Yeah.
We cannot integrate it,
Yeah.
everything in the BDN. No.
The same in the to talk about the now in the food advancement in school.
Yeah.
In the by the way, in the now in the government to put more in the Ministry of Education.
Okay.
For the
School meal.
school meal and food advancement in school now. So I think very quickly to change in the Ministry of Education doing very well with the by the law and so now in the degree and the circle for the nutrition and for how to improving nutrition started for the school children. So that's why I think in the book more. So yeah, I think by the way you can just before in the set up a lot of the modeling for the school meal and the school nutrition. So now I think it's the same for the food system of the tourism for I think another point I remember I talk about the in invention is a thinking. Okay, let's go. After that I think
That's okay. It's okay, Dr. Mats. It's getting towards the end of the day, so.
Already know.
I have a
Very topic, and then we don't know what to do. We don't do it.
Okay.
maybe I have a comment on the conception of what is a healthy diet. So I think that should pay attention on also just include safety.
Yes,
I think that
yes.
even in the project we focus more on the nutrition, etc. But for for the food safety, for communication, and I think that we need to integrate. You know that now the Canadian government, they just finished a project on the food safety. The safe road just finished, but they feel that only with the classical conception of food safety is not enough to achieve food safety. So they are developing a food system
Okay.
thinking. So I think that the food system we need to integrate besides safe and nutritious.
So I think
that
what we've been using in BDN is there is a FAO WHO definition that does include that. So there are 4 components of a healthy diet. And I can share the document, but it does include safe.
Yes.
And so I think that's very important. And certainly here in Vietnam, we know it's of a concern of consumers.
Yes.
So
because when we work on the development activities for application, we have to see we talk about the food system as a whole. So I think that we need to see all the different aspects related to the.
No, it's a good point. It's a really good point. And it's interesting because Vietnam has quite a bit of development around traceability and food safety for export.
Yes.
Right. But maybe not as developed for domestic production and consumption. Yeah. So anyway, it's a big conversation. Yeah.
Yes, because this is related nutrition and also food safety. In Vietnam, we don't have a food law. We have only food safety law. So that's why little bit nutrition, etc., is a little bit fragmented. If we have a food law, as in Europe, is you can cover different aspects of the food. Is maybe better, but I don't think that this is the willingness of the government. But I think that we should include. And when we read the food safety law, they also have some article related to nutrition. Just means we cannot separate completely.
Yes, the law separate. So
but the name is food safety law. But inside, when we go, we did have several articles on also on labeling, etc. Not detail on the nutrition labeling, but start to talk about this a little bit.
So preventive medicine different. So in the
implementation,
it's a together. For example,
related
the communication for the consumer and the data population. We own way together to talk about the safety
better.
and send and the legislative.
Yeah.
Yeah, own way.
So healthy diet.
Lọt phòng bệnh.
Okay,
Yes.
okay, very good.
Tiếng Việt là gì? Lọt phòng
Vậy.
chứ không phải phòng cháy chữa cháy. Phòng bệnh.
Okay, okay. Okay, great. Anything else? I think, yeah, if not, we're getting to the end. I think we can wrap up the meeting.
Okay.
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 Rasmi, thank you very much for staying online. I hope it was useful.
Absolutely. Thank you. Thanks a lot.
Hopefully we can welcome you to one of these in person at some point.
Yeah, that would be great.
I would be very happy to have you come and present CAPSHA in person. That would be nice.
That would be great. I'd love to come.
Next meeting, you will be in person in Vietnam, in Hanoi.
I could come, definitely.
Okay, well, thank you. So let me just wrap up by saying thank you to everyone. I think we have very, very clear next steps, both for BDN and also for CAPSHA.
Yeah.
I think that's very good. It was very exciting to hear all of the updates and how quickly things are moving in the health sector and the work that has been done in the agriculture sector as well. I think it's very positive as usual to see how things are moving. Yeah, we definitely look forward to continuing the collaboration from CGIR under BDN with all of you. And yeah, we will be back in touch for our next CCU meeting at some time in June, maybe, yeah? Yeah.
Yes.
Okay. I'm looking at the boss over here.
No.
Yeah,
Yeah.
look at the boss.
Every 3 months.
Every 3 months or so.
Yeah.
Okay, thank you, everybody. Thank you, Rajman.
Bye-bye.
Good, very good.